Hi, welcome back to my channel. In this video, I will be talking about Paget's disease, the most important points that you need to know about Paget's disease. So first of all, Paget's disease is also called as osteitis deforms. Then coming on to the defect is in the excessive and abnormal remodeling of bone. All right, the genes that are involved is sqstm1. This is called as the sequestrum gene. Basically encodes for a scaffold protein for nf kappa b signaling pathway. All right, and the second gene that is involved is TNFRS11A. Basically it gets the inactivation mutation. Now let's talk about the clinical features that are most important in this specific disease. Now coming on to the clinical features, first of all, what you will see is that the bone, it is warm to touch because due to increased vascularity. All right, then you have platybasia, which is the descent of cranium into cervical spine, which in turn leads to the spinal cord and nerve compression. Then there is increased maxilla, so constant changing of denture, plus there is increase in skull size, so it is also called as changing hat disease. Then you will see brim sign, that is increase in pelvic size. All right, then there is a thing in which we divide it into three parts. Basically, one is the osteolytic phase, okay, then we have mixed, and then we have sclerotic. Now in this, you should know this is the hot phase and this is the cold phase. All right, here you can see blade of grass, flame sign. Very important feature is osteoporosis circumscripta, which is nothing but isolated lesions in skull. In mixed, we will see jigsaw or mosaic pattern. We will see cotton wool appearance and picture frame vertebrae. In cold phase, you will see tam o shanter deformity, which is widening of cranium. All right, then we will see leontine facies, which is basically the person looks like lion. Then we can also observe that all these features are more common in lumbar spine than sacrum. Now coming on to oral manifestations. Now in oral manifestations, you should till now know that oral manifestations are more in maxilla than in mandible. Then there is flat palate. Then we have widened alveolar ridge, generalized hypercementosis. We have waddling gait. Then we have important Lincoln's sign. What happens is, on nuclear medicine scan, the dye gets accumulated in mandible, giving a sign of looks like beard of Abraham Lincoln. All right. Then coming on to the investigations, lab investigations. Now in lab investigations, what you will see is there will be normal calcium to phosphate ratio, but there will be increase in the urinary hydroxy proline, and there will be abnormal alpha CTX to beta CTX ratio. Then histopathology. In histopathology, we will see that there are resting and reversal lines in sclerotic bone, and we have jigsaw puzzle or mosaic pattern, and we have interconnected trabeculae. All right. Now in the recent update of the Paget's disease that I added in this specifically is that in the urine, in recent update in urine we get to see the excretion of bone specific collagen cross link and terminal telopeptide X, that is NTX, as well as collagen C telopeptide. Now this is CTX. Now what are these? These are bone resorption markers. All right. So this is all that you need to know about Paget's disease. I hope I made it easier for you to understand. If you like the video, do subscribe to my channel. Thanks for watching, and